Okay, good afternoon. Welcome, everybody. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include names of companions attending. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk. Reminders, please take the online learning kung evaluation test exercise for mastery of learning and have a perfect score to get a certificate. The link is already in the chat box. Okay, example of the certificate is shown below. Another reminder, 50 OLETE certificates entitled 1 participants to a voucher of ROJoson telemedical consultation. Another request is that those who are not planning to take the OLETE, which I'm not forcing you to, but I would encourage that you take it. Now, please type in your feedback in the chat box during the open forum. Let's now have a group picture taking before we start the pep talk proper. Please show your face now on the video. Okay. 1, 2, 3. I have a patient empowerment program which I'd like to empower the lay people or patients to take control in the management of their health. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer, again, depending on how long the enthusiasm of the participants will last and how long I will also last as a speaker, as a lecturer. My pep talk today is entitled Reading and Interpreting Laboratory Test Results. This is part of the health issue course. The empowerment objective is for the lay people to have an understanding of the importance of reading and interpreting laboratory test results in their health management. The contents of the pep talk for today will be the following. What are laboratory tests? What are the general types of laboratory tests? How to read and how to interpret lab tests with numeric values? How to read and interpret lab tests with narrative description and conclusions. And then what are the issues on laboratory tests, especially on the indications? Then examples of dilemmas and errors in lab results and interpretations. As a backgrounder on this talk, a lot of Filipino patients have laboratory tests. Actually, it's not only in the Philippines, but also abroad. Okay. So a lot of us, Filipinos, have laboratory tests done for one reason or another, but usually resulting from the so-called screening fad or craze. Okay. Or these are all ordered, prescribed by physicians who are the so-called ritualistic and maximalist. Okay. Then they ask me to read and interpret the results. I am a minimalist physician. As a minimalist physician, I don't subscribe to the screening fad of lay people as well as physicians who are usually ritualistic. They just do things on a habit basis, and maximalist, nice to have, they order a lot of things. And I'm also the one who outrightly I'm not the one who outrightly want to please patients just because of their desire for the screening laboratory test. I do laboratory tests only when indicated. And some of the indications or the basic indications are the following. when there are patients with symptoms and signs which I am not very definite with my clinical diagnosis, that I need some help, some assistance from laboratory tests. So that's the foremost indication. Number two, in patients without signs and symptoms or asymptomatic, but there is a high risk for a particular disease. So then that's the time I do laboratory tests. So these are the two basic indications for my ordering for laboratory tests. In my practice, I cannot avoid or refuse patients coming to me for interpretation of results, okay, requested by themselves or other physicians. And because of the prevalence of these events, marami yan, they always ask me, I have decided to try to write something about them, particularly to advise the lay people on how to read and interpret the results of the lab test. As I said, I'm not fond of doing this, of ordering lab tests left and right. Okay, so I like to empower the patients to know the principles and processes and the caveats, the warnings, okay, of the reading and interpreting lab results. So I want to empower them. So along the way, as I said, I don't like it, what they're doing, but along the way, if I do this, help them, I can convince them to have lab tests done only when indicated. To start with, laboratory tests are diagnostic tests to determine if there is or are abnormalities present or not in the test done on patients. So these are diagnostic tests. Then we try to determine meron bang abnormalities na andun sa test, okay, na nagawa na, yung mga nagawa na, okay? And the basic definition of laboratory tests is that they are laboratory tests done on a part, or the whole of the patient's body, performed in a laboratory setting. Kaya tinawag ng laboratory test. Laboratory setting where there is a controlled environment with appropriate equipment, supplies, and available certified expertise. Yung mga nagbabasa. Okay? So with the advent of so many kinds of diagnostic tests being done and promoted, not to say commercialized, the laboratory setting has expanded from one that examines samples of blood, patient's blood, urine, fluid, or tissue. Okay, so these are the so-called laboratory centers. Okay, to radiology centers where they do X-rays, nuclear imaging centers, MRI centers, PET scan centers, endoscopy centers, etc., etc. So marami yan, no? Okay. So those done before, when you say laboratory test, it's usually referred to those done in the laboratory setting that collects blood, urine, and urine. But nowadays, the laboratory testing has expanded to mga X-ray, nuclear medicine, PET scan, etc. Thus, diagnostic reports are coming from these various kinds of laboratory centers. The diagnostic reports will be based on the parts of the body, patient's body being examined, and the type of technique of doing the diagnostic test. Parang, let's say MRI centers, they use MRI. CT scan centers, they use CT scan. Endoscopy center, they use endoscopes. What are the two general types or the general types of laboratory tests? So essentially there are two general types. Number one, whether they contain numeric values that will denote normality or abnormality. Yung mga may numbers, numeric values. Number two, where they contain a narrative description or interpretation by a certified reader, okay, of what was seen for the so-called findings on the test, which also denote normality or abnormality. And if they are abnormal, the readers usually give a possible diagnosis or diagnoses. Okay? So these are the two general types of laboratory tests. Examples of laboratory tests with diagnostic reports that contain numeric values. Okay? So you have complete blood count, CBC, metabolic panel, lipid panel, thyroid function test. So example here is a CBC, okay, test, okay, red blood cells, white blood cells, platelets, etc. And then on this column, you have the normal values for men, normal values for women. So you can see this, there are numbers that connote the normal values. Okay. Example of metabolic panel in which they test the electrolytes, liver function test, kidney function test, and others. Okay. Again, you have the normal range or numbers connoting some normal values. Other metabolic tests that are being done, glucose for the sugar, calcium, sodium, potassium, chloride, creatinine, etc. Okay, again, you have the values here. Then albumin, total protein, okay, bilirubin, etc. Okay. And then for the lipid panel, these are usually for the so-called cholesterol, no? High density, low density, triglycerides. Again, you have the values here, which represents the reference range. No? So it's all in numbers. Then you have the thyroid function test, okay, various tests. Then you have the numbers, okay, that connote the range, the normal range. Okay. So the other type of laboratory test, as I said, is the one that contains narrative description and interpretation. Okay, so these are the X-ray reports. So they don't come in by numbers in terms of report. Ultrasound, CT scan, MRI reports, and others. So this is an example of X-ray report showing the narrative description at the chest X-ray findings. So this is a narrative description, and then conclusion now or impression. Okay. Ultrasound reports, and then. So narrative description of the findings. Okay, findings consisted of so and so, and then you have the impression here. Okay, possible scarring of the renal cortex, etc., etc. CT scan, and then. So you have the narrative, okay, description of the findings, long ones, okay, up to here. And then you have the impression. The impression here is no evidence of pulmonary embolic disease. This is just a sample, okay? And then there are some comments here, okay? Note that some diagnostic reports have combination of numeric values and narrative descriptions, okay? There are some. Like urinalysis, meron siyang combination. Example, color, just say yellow, is it light pale or deep amber? Clarity, okay, whether it's clear or not. The rest, there are numbers. pH, specific gravity, okay. RBC, less than 2, okay. RBCs per high power field. So there's a combination of numeric reports and narrative description. Some information on the diagnostic reports on numeric values. So these reports contain numbers that will denote normal values, okay, or abnormal values, okay, as a result. The values serve as a reference for physicians or patients to interpret the test results. The numbers that you see can come in range or the so-called reference range, okay, so such as from 10 to 15, so there's a range. Or sometimes it's just one number, okay, including the number 0, wala, 0. So it's still a number. For the latter, meaning those with one number, it may be just the cutoff value of normality and abnormality. For example, if the cutoff is 300, okay, and there is stipulation that any value below 300 is normal, and any value at 300 above is considered abnormal. So this is an example of a numeric value using only one number, the cutoff, not the range. Walang range, no? Okay. So thus, in the laboratory test with diagnostic reports containing numeric values, one will see or should see at least 2 columns. Okay, so you have the results and then the reference values here, or the normal range. Now, some nowadays, a lot of laboratories also contain some another type of reporting. They call it SI, or International System of Units. So if there is a inclusion of this kind of reporting, then there will be about 4 columns, okay, 4 columns. So, but basically it's still two, result and then the range, whether it's in the conventional uh, terminology or system, or the new system is the so-called International System of Units, or SI. The reference range. What is the reference range? Now, it's a set of values that includes the upper and lower limits of a lab test based on a group of otherwise healthy people, meaning it has been gotten from a study of a group of healthy people, and it is based on the results that are seen in 95% of the population. So here, so the normal results actually is from here to here, okay, the two ends of this curve. But usually when they talk about reference values, it includes only this one, 95% of the healthy population. Okay. So not all lab results that fall within the reference range, suppose this is the reference range. So if they fall outside, now, okay, let's say way, way below, way, way above, now, so they are not, strictly speaking, they can still be normal, okay? They can be still normal, okay? But if they fall outside, sometimes you think it's already abnormal, so if it can be taken as false positive because they're still normal, okay? So sometimes patients whose test results are outside the reference range, here below or up, may be healthy pa rin, and some patients whose test results are within the reference values may have problem. So no guarantee that when your result is within this reference range, you are totally, absolutely normal. So meron pa rin abnormality. Kung merong abnormality at within the range ka, that's what is called false negative. So here is called false positive. Also, the reference values for a test may be different from different groups, for different groups of people. Example, women and men. Okay, iba-ibang values. Okay, and then the other thing that we have to note is that different laboratories may be using different reference ranges. Kaya mahirap na i-memorize yung mga normal values. We just look at what they posted as the reference range. So the differences may be due to different laboratory testing equipment, chemical agents being used, and analysis technique. So the advice is that to interpret the results, we just have to rely on the reference range or values provided by the laboratories where the tests are done. So if you have tests done in one laboratory, different values, another test, you do it in another laboratory, it's different values, then you're going to ask which one is correct. Now, so you just have to base it on the report given to you, okay? And hopefully those reference range, the numbers there are accurate, okay? Now, how to read and interpret laboratory results, now reporting numeric values. We start with the numeric values, okay? So you try to look at the results, okay? Try your best. If you want to interpret it, okay? Bahala ka na, basta look at the results, okay? Then for the laboratory test with reference values, you try to see if the results fall within the reference range, okay? So yun ang unang gagawin mo. Example here, yung nakapula, hemoglobin is 123, so it's below the 133, okay? So below siya, okay? Now later on, we have to decide whether this normal is still within the normal limit or abnormal na siya. Ganon din dito sa MCV, 76, 77, 1 point lang, okay? And then 22.4 dito, 26, no? Okay. And then this one is, again, in red, 293 because it's below the normal range. The lowest limit is 330, okay? Another example will be ito, thyroid function test, FT3, FT4, and TSH, okay? So ito yung results, 2.54. So if you look at the reference range, no, mababa siya, di ba? Kaya low, L, no? And then if you look at the T4, normal siya. Now it's within the range. Now if you look at the TSH, 7, ang highest limit, upper limit nito ng normal range is 3.7, kaya mataas. Okay, 3 and then 7, mataas ito. Okay? So if they do, meaning, so if the results falling within the reference range, okay, then they are usually interpreted as normal, usually, okay? Basta nasa within the range siya. But one has to make sure that the patients had no symptoms or signs of a medical condition or disease associated with the test done. Okay? So if the patient have symptoms or signs, the result may be false negative. Ibig sabihin, hindi talagang negative, but baka mali. Okay? So a repeat test or another more sophisticated or higher level test may be done to ensure that a false negative result is not present. Okay? So decision ng doktor na yan. Okay? Now, on the other hand, if the results are not within the reference range, yung kanina sinabi natin within, no? But this one is outside the reference range, then a red flag is raised, but they have to be interpreted properly before considering them as abnormal. Okay. So first thing to do is that you have to look at the degree of deviation from the normal reference range. The greater the degree of deviation, the greater the chance for abnormality. If there is a small degree of deviation, chances are the out-of-range values can still be considered normal, but you have to look at the symptoms, okay, and other tests. Okay, but a dilemma exists. Okay, there are no established rules. Kasi maraming values yan iba-ibang values. At the moment, there are no established rules that would say that if this or that degree of deviation is present, it should automatically be considered as abnormal or still normal. So in the end, it will be a judgment call by the doctor, by the physicians. Okay? The second thing that one has to do is to see, basta yung pag nasa labas ng range, no, is to see if there are symptoms and signs indicative of a true medical condition being present. And if present, whether the test with an out-of-range values is pointing to it. If yes, the out-of-range values should be considered abnormal talaga, even if the degree of deviation is slight or small. Basta may symptoms siya of a particular indicative of particular disease, kahit na maliit lang deviation, talagang may sakit. But if there are none, then the out-of-range values can be considered normal. Okay? Particularly if the degree of deviation is slight or small. Kaya importante yung titingnan pa rin yung symptoms ng pasyente. No? If the degree of deviation, malayong-malayo, okay, is big, okay, even without symptoms and signs, abnormality should be considered. Okay? Malayo, kahit na wala siyang symptoms, sasabihin mo, ay talagang abnormal ito. Okay? But again, the dilemma is here. We don't know the exact cutoff. The cutoff for small and big deviation is not yet established. It could be 5%, 10%, 15%, okay, higher, okay, okay. Probably 20%, this is my gut feel, my experience, probably 20% higher or lower, okay, is definitely significant already. No? But yung 5, 10, 15, medyo nasa gray zone. No? It has to be emphasized that it is not simply comparing the reported diagnostic results with the reference values or ranges. Hindi lang yun, ha? You have to go beyond that. One has to correlate the results with the patient's other medical data if there is. Baka meron siya ibang nagawa, no? Such as the presence also of presence or absence of symptoms. That's the most number one thing, the first thing that you have to investigate. And if present, what are they? What are the symptoms present? What are the physical examination findings by the physician? And is the patient taking medications before the test? Because the medicine can affect the test also. And then are there other tests done, okay, which can be used to correlate? And other circumstantial situations like probably stress in pasyente, no? And then pagod na pagod. No? So sometimes it might affect the values of the diagnostic test. So when interpreting diagnostic tests with numeric values spatially ranges, one has to take note that the laboratory test set up normal ranges from this is just based on population studies. No? Okay, as I said, 95, they take the cutoff is 95%. Okay. So the standard normal ranges for tests with numeric values are based on the use of the bell-shaped curve. Yung mga natatandaan pa ba yung mga natin, statistics, basic statistics. Okay. So normal here is usually defined as those values that falls within the two standards. Okay, here. Okay, so 95%. No? Okay. So now those outside, may mga 5% chance that okay, abnormal test, the abnormal, kung nakalabas dito, usually we consider them as abnormal already, but strictly speaking, they can still be normal. Okay, so that's why not all which fall outside the normal, I think supposed to be normal, are automatically abnormal. The physician has to come in to make a decision. My recommendations for the those with narrative description and interpretation naman, this is the second type. My recommendation is you can take a look and read the contents if you want. Okay, so this might be helpful in promoting your some knowledge, some information, patient empowerment. Okay. I would encourage you to do that, but be guided also by what should be done. Okay. However, as a lay person, chances are, I'm going to tell you, you will not understand or more so interpret the narrative descriptions and conclusions of certified readers. Okay? Kasi maraming lingo yan that you cannot really understand. Okay? So have the narrative reports, diagnostic reports, read and interpreted by a physician whom you trust, okay? And let him make a decision on the report. Even for physicians, as I said, kaya ako sinasabi na medyo mahirap, even for physicians, they have to interpret the words or phrases used by the certified readers and have to read between the lines. Okay. In addition, they have to correlate with the findings and conclusions of the readers with the symptoms and signs, other tests, other circumstantial situations that the patient may have, to make a decision whether everything is normal, every finding is just a mere variation, biological variation, something abnormal is being suspected, or there is really an abnormality going on. So the doctor will have to make a decision on this one. At times, another difficulty here, challenge is that that's why it has to be the doctor. The doctors will have to check the accuracy of the reports and may have to have discussion with the readers of the narrative diagnostic reports. Okay, but there are some doctors who don't do that. They just accept whatever diagnostic reports are given them. But the best doctors will be those who are, as I said, minimalists, who can analyze things, who are not just ritualistic, just accept things as they are. Okay, so they try to analyze the accuracy of the reports. They go out of their way. Okay. In practically all narrative diagnostic reports, there is usually a caveat statement that runs like this. If you have diagnostic test, narrative diagnostic test, you can always see this particular statement, which runs like this. This result is best interpreted by your attending physician in correlation with your clinical data, imaging, and laboratory results. Okay, so there's a statement there. And then that's also the reason sometimes the radiologists, the people doing the diagnostic test, the ultrasonographers, they do not want to discuss things with you. They would rather have your attending physicians discuss the findings. Another statement to the same effect, this radiologic interpretation is only part of the overall assessment of a patient's condition. It must be correlated with the clinical, laboratory, and other ancillary parameters for a comprehensive analysis. Therefore, radiology reports are best explained by the attending physician to the patient. Another important thing to remember when layperson reads the diagnostic reports, that contains a recommendation. A lot of times there's a recommendation, okay, by the reader, whether radiologist or otherwise, on additional tests to be done. Okay, so suggest this one, suggest biopsy, etc. Okay, but remember, these are just recommendations. You don't really have to follow. Okay, recommendations lang yan. Okay? Even the doctors, okay, doesn't have to really follow. Example, this is an example. There's an impression here. Right thyroid mass, thyroid 5. This is highly suspicious for cancer. Okay, and then biopsy is recommended. Okay, so this is being recommended by the ultrasonographer of the one who did the thyroid gland examination. So note, your attending physician should be the one to decide, okay, what to do next after interpreting the report. Okay, after re-examining you, he has to re-examine you. As I said, there are some doctors who just accept the diagnostic reports as is. Okay, this is not the best scenario. Okay, so the doctor will have to re-examine you, and then after correlating it with the other data, okay, then he come out with a conclusion. Okay, so he may or may not follow the recommendation of the certified readers of the narrative diagnostic report. Okay. So at the end of the day, after receiving your diagnostic reports, whether with numeric values or narrative description and conclusions, you can read them if you wish, okay, for patient empowerment purposes, okay? But follow the principles and processes and caveats on interpretation that I just mentioned above. But your attending physicians will have the last say on the conclusion, whether abnormality is present or not, number one, or on what to do next, such as to repeat. Sometimes they may have to call for a repeat, and then there's no, or they make a decision, no need to repeat. Ano lang yan, variations lang yan, just observe. Pwede din ganon, na? And after hearing the explanation and recommendations on what to do next for your attending physician, this is for you as a layperson, feel free to ask questions as needed for further clarifications. Okay, maraming tanong dyan, maraming things that you have to ask. Okay, so the decision on what to do next should be a shared one between you and your attending physicians. If there is a need for a second opinion from another physician on the conclusion and recommendation on what to do next, which is very common, okay, that's happening now, go ahead. You are free to do that. You have the right to seek a second opinion. This is part of patient empowerment. Knowing the principles and processes and of the reading and interpreting the laboratory results and their associated caveats is also part of patient empowerment. That's why we had this as part of our lecture on the PEP talk. Now, as to the issues in the laboratory testings and results, there are a lot, okay? The foremost issues is that too many laboratory tests being done, okay? Too many, okay? As I said, there's a screening fad or craze, okay? Many of which are usually not necessary, okay? This is also observed abroad, not only here in the Philippines. And most of them have results, especially the alarming ones. One, difficult to interpret. As I said, walang definite rules. Ano ba yung cut off? Ano ba yung strictly the normal, abnormal? Which one can be just observed? Okay. Number two, they can lead to a cascade of other tests. Ibig sabihin ng cascade, another test will have to be done. Another 1 or 2 or 3, tuloy-tuloy yan. Okay? Okay. And then number three, alarming test results that have caused undue patients' anxieties. I suppose some of you have experienced this. And then it has also led to unnecessary and erroneous treatment. Okay, so it doesn't mean that when you do the test, tama ay mga treatment. It can lead to erroneous treatment because yung mga test results are not 100% accurate also all the time. And then the other drawback is that it can cause undue harms, undue necessary expenses, and then have wasted limited healthcare resources. So these are the issues that we have to consider. Indications for laboratory tests. Okay, this is very important to remember. Number one, screen for a disease or exclude its presence. Number two, to have a more definite diagnosis after clinical evaluation. When you say clinical evaluation, it means after doing a physician doing history, interview, and physical examination. Okay. Number three indication will be to determine the severity of the disease present and to prognosticate, meaning to project the outcome. Number four, to monitor the progress of the disease and also the treatment. So remember these four indications. Valid indications for screening. The first one, okay? So if it's mandated by law, wala tayong magagawa. Okay, example will be the newborn screening. So they must have some basis for making this into a law, okay? Then occupational, travel, and organizational requirements, wala rin tayong magagawa, okay? Example, yung mga piloto, they have to do a lot of tests because they want to avoid some accidents, okay, for the safety of the people riding on the plane, okay. Then the other indication will be high risk for a particular medical condition or disease. Example, you have three families with a family, you have a history of disease in three members of the family or two, okay. So you have that high risk for a condition, so you need a screening for that. Valid indications for this one to have a more definite diagnosis. Okay, so there must be uncertainty in the clinical diagnosis. Kung certain na certain ka na, you don't need to do the diagnostic procedure anymore or diagnostic test. Number two, if a more definite diagnosis is needed to plan out a specific treatment, especially one that will be complicated or complex. So this is another indication for doing the test to be more definite after the diagnosis derived from clinical evaluations. For the determining the severity, okay, these are the valid indication. You want the timing will be the treatment will be affected. You want to know, is it very severe that you have to act right away, okay, timing, and then the treatment plan would also be affected. If it's terminally ill, medyo advanced na, then they can the doctors and the patients can decide on the palliative care already. Okay, this is an example. Okay. Now, to monitor progress of the disease, okay. So valid indications, if you want to get a more definite diagnosis, because sometimes you can observe, but when you observe, you find out something's crop up and you want to be definite about it, then you go for a test. Okay. Number two indication will be to know the outcome of the disease and also the treatment. That's what is meant by monitoring the progress of the disease and treatment. And then if there's something that crop up that you need to change your management, okay, you institute new or additional treatment as indicated. Okay. So lack of valid indications here, well, kung walang indications as mentioned, they usually lead to screening fad or craze, okay, and inappropriate usage of the diagnostic test. What is an inappropriate or unnecessary test? It can be defined as any test where the results are not likely to be medically necessary for clinical management of the patient. Yeah, inappropriate or unnecessary, okay, not likely to be medically necessary. And then, so anything that falls outside the stipulated valid indications, okay, so strictly speaking, all the lab tests done are considered inappropriate or unnecessary. The common practice, not only in the Philippines, but also all over the world, is the so-called shotgun approach. That means you use a shotgun, maraming bala, tira ng tira. No? So all possible lab results are done upfront just to hit the bullseye, okay? Just to get to the right diagnosis. This is not recommended. So what is recommended is just to use a rifle approach in ordering tests to hit the diagnosis being suspected. So which one do you suspect most? And then you want to be definite about it, then you do a certain 1 or 2 lab exams only, not a lot of lab exams. The risk of unnecessary laboratory testing. Tests ordered indiscriminately may produce results out of the normal range without the disease and lead to additional unnecessary testing, the cascading, the so-called cascade. The patient's risk is increased from performing unnecessary tests since every procedure carries some risk and unnecessary therapeutic measures with potential adverse outcomes may be instituted. So there's no such thing as no risk for all the tests. Okay. If laboratory tests are ordered without sufficient indication, money, monetary, finances, okay, and personal resources may be wasted. Inappropriate laboratory test ordering leads also to a high probability of false positive abnormal results. False positive results are harmful psychologically. Baka wala naman, pero sasabihin meron, di ba? And financially, because you have to do a lot of cascading tests, okay, to the patient and also as well as to the healthcare system, which have limited funding or budget. It has been shown that when you do a lot of tests, more than half, now, kung walang indication, just screening, more than half of the abnormal tests will be abnormal. Okay, kahit na slightly abnormal, no, but there's a issue of how to deal with it. No? Okay. So this is just 2018 pa lang. There's a group of Canadian family physicians who make a survey. If they order a lot of screening tests, okay, more than half of all those will have abnormal tests, which could be false positive. Now, laboratory errors, another issue. Laboratory error is defined as any defect that from the ordering of tests, starting from the ordering of tests through the reporting of the results, okay, as well as appropriately interpreting and reacting to them. Okay, so an error in the clinical laboratory may occur in the following phases: pre-analytical, analytical, and post-analytical. And it is said that this entire process is impossible to perform perfectly. Walang so-called error-free. May mali talagang mangyayari. No? Any laboratory analysis strives to reduce, they just try to reduce the uncertainty and estimate the magnitude to an acceptable degree. Meaning, baka pwede ng 5%, 10% error, yan ang target nila. But there's no such thing as 100% perfection or zero error. So when you say pre-analytical components, okay, these are the steps being done with the yung doctor's request, and then the examination, the patient's preparation, collection of the sample, and then you transport to and inside the laboratory, ending with the analytical examination. Okay, this is the part of the pre-analytical. Maraming nangyayari dito. No? And then post-analytical, this is defined as the processes that occur after the examination na-examine na, then including yung systematic review by the physicians, formatting, interpretation, itinatype na, authorizations for release, reporting kung saan mali ang pangalan ng pasyente, gano'n, storage, examination, samples. Again, there are errors occurring here. Now, in between pre-analytical and post-analytical, you have the analytical component, which begins when the patient specimen is being prepared for testing, and it ends when the test results is interpreted and verified by the technologists or the doctors in the laboratory. So it has been shown that errors can occur at any stage and result in an inaccurate report production, which can have an impact on patient care, such as misdiagnosis and incorrect treatment. And the most common errors occur in the pre-analytical and post-analytical, and less on the analytical phase. But there's still a good percentage of 7 to 13% of the errors. Okay, malaki pa rin yun. No? Now, looking at results, issues on the results vis-a-vis the reference range. Okay, so if within the reference range results, one is still not 100% certain that the results are normal, even if the patients do not have symptoms of the disease. They may be false negative. There may be laboratory errors and circumstantial situations in the patient, such as medicine taken, biologic variations that made them fall within the range, the normal range. So remember, normal result is not 100% not always normal. Okay, but most of the time, most of the time lang, not all, those result falling within the range are considered normal, especially if there are no symptoms of a disease. So this is just a general guide for us. Now, those outside the normal range, okay, the question is it outrightly abnormal? The answer is no. But somebody will have to decide, and usually the attending. So they go by some guidelines, and most of them will go by a gut feel. So walang established standards. That's why nothing is absolutely certain also. Okay. So the result may be a product of laboratory errors, circumstantial situations like foods and medicines taken, biologic variations. Okay. Abnormal results is also not always abnormal. It could still be normal. Okay. However, most of the time, those results falling outside the range are considered normal, okay, especially if the degree of deviation is small, let's say 1 point or 1% higher or lower, and if there are no symptoms of a disease. So again, going back to this important uh, recommendations, caveats, okay, the high incidence of results outside the range, the incidence is more than 50%, okay. It's hard to explain the cause, bakit siya mataas, bakit siya mababa, okay. It may be due to laboratory errors, circumstantial situations, biologic variations, etc. And then it is also difficult to decide with certainty. Even the doctors cannot decide with 100% certainty. So the advice is just to avoid doing lab exams without good indications. And these are the indications. And remember also that the more tests that you do, the more likely you are to get at least one false positive outside the laboratory range. Okay. So try to aim to limit the number of tests to those that are relevant to the clinical situations, yung mga symptoms mo, okay? Rather than requesting for a battery of tests or screening battery. Now, the last topic that I want to discuss, which is also very important, is to give you examples of dilemmas and errors in lab results and interpretations. There are plenty of personal examples, meaning my experience, but I will just cite about 6 for this particular pep talk. I will amplify on these dilemmas and errors in lab results and interpretations in future pep talk. So let's start with the out-of-range numeric values like CBC, urinalysis, lipid profile. The example here, okay. So adult males, ang normal range is 14 to 18. Suppose the hemoglobin, this is for the CBC, hemoglobin shows it's 10. Okay, so 10 versus 14. Medyo malayo na, no? Okay, so you can say that this is really abnormal unless the patient is pink, yung mata niya, yung conjunctiva is pink, okay? Yung nail beds niya is pink, okay? Okay. Kung pink yung conjunctiva, pagkatapos hemoglobin is 10, baka there is a laboratory error. Okay. Now, if the hemoglobin is 13, just 1 point below, you can still consider this as normal and acceptable, and you don't have to treat. Okay. So the ill effects of this test, if you do it routinely without any basis, you might be caught with anxieties. Okay, anxiety on your part. Okay, of course, sometimes the doctors who's really compassionate, they also have anxiety for you, and then the doctors might do additional tests just to check whether to accept the results that you get. Okay. Urinalysis, WBC, white blood cells usually signify infection. Normal, let's say normal is less than 5 per high power field. If the result shows that if more than 10 high power field per high power field, this is because 10 is medyo mataas. No? You can say that this is really abnormal unless the urine is erroneously collected. Kung minsan mali ang pag-collect ng urine, kaya nagiging mataas. Okay? If 7, baka may still be normal kasi konti lang yung difference, especially if no symptoms. You just observe and the patient does not need treatment. Again, but all these things that that will come out that falls outside the range will cause anxiety of the patients, and sometimes doctors will do a lot of more tests for you. Total cholesterol. Okay. Suppose the cutoff is 200, under 200 are healthy. Doctors treat readings from 200 to 39 as borderline high, and reading of at least 240 as high. Okay, ito yung recommendation, at least 240 talagang high. Okay, so if it's 205, okay, 205 medyo mataas na ng konti, di ba? So question is, normal ba ito? Pwede na walang gagawin? Ganon, no? So you have all, again, you have all these issues, anxiety, cascade of tests being done. Baka gawin ka ng am I back? Sorry for the interruption. Saan na ako? So I'll make sure that, can you hear me? Okay.
Yes, loud and clear.
Yes.
Good, good. Okay, we learned our lesson last time. Okay. So now for the thyroid function test, okay, ito ha. Ito yung pasyente, ZJ, 66-year-old female, had thyroid function test done as a screening. This was not ordered by me, kasi as I told you before, I don't order things left and right, okay? So there are no symptoms of hyperthyroidism or hypothyroidism. So she got the test, this test done. So FT3 low, FT4 normal, TSH high, mataas, okay? So I decided to ask for a repeat kasi hindi ako naniniwala sa results nito, no? Kasi wala siyang symptoms, no? So the repeat shows normal FT3, normal FT4, normal TSH. Yan, normal na lahat. Okay, just 1 month, I think 1 month or 3 weeks to 1 month after. Okay, without medications, without any treatment. Okay. Now, the lesson here, if there were no repeat tests ordered by me, patient could have been treated unnecessarily with medications, which can be a lifetime treatment. Okay, forever na yan. Okay, and she's branded as hypothyroidism kasi mataas ang TSH, mababa yung T3 niya. Okay, but she has normal thyroid function test after all. She will have the unwanted lifetime anxiety because iisipin niya, ay, nagkaroon ako ng thyroid disease. No? Okay. Also, she may have a cascade of other unnecessary tests like ultrasound and biopsy. Yung sa akin, one test lang, another test. Pero for some doctors, they might do ultrasound, biopsy, okay, to do further examination. Fortunately, a repeat test has prevented these errors and other possible negative consequences. Kaya importante rin ng doktor. Okay? Breast ultrasound, example. AD, 61-year-old female, had breast ultrasound and mammogram for screening. No symptoms, no palpable breast mass. Initial report in one hospital, BI-RADS 4. When you say BI-RADS 4, it's suspicious for malignancy. Then I had it repeated, it shows BI-RADS 3, probably benign. Okay, ba yan? Okay. So this is the picture of the test. So you have BI-RADS 4 here. Okay, suspicious for abnormality done in one hospital. Okay. Then another, I usually have it repeated in another hospital. Okay, not telling the second hospital the results of the first test. Okay, so here it comes out to be BI-RADS 3, probably benign. Okay. So if there were no repeat tests, patients could have undergone an unnecessary operation. She was indeed scheduled for the operation, but sought second opinion. she would have the unwanted anxiety of thinking that she has breast cancer. Okay. Di ba nakakatakot yun? Okay. Also, she may have a cascade of other unnecessary tests like that, like ano ba ba? Biopsy, okay, that may be needed to do further examinations. Fortunately, one repeat test has prevented this error and other possible negative consequences. Last example, gallbladder ultrasounds. AC 55, these are actual patients. 55-year-old male complained of difficulty of urination. A whole abdomen of ultrasound was done. Hindi ko alam kung bakit whole abdomen. Kaya nakita, aside from the prostate, dapat if it's done for the investigation of the prostate, nakafocus lang sa prostate. Okay, so the whole abdomen shows enlarged prostate and then gallbladder stones reported, and he was advised gallbladder surgery already. Okay, kasi may nakitang gallstone pero wala siyang nararamdaman. Okay, so he sought second opinion from me. I asked for repeat ultrasound in another institution. Repeat test showed gallbladder polyp, which does not need an operation. So even if a repeat test showed gallbladder stone, okay, kahit may na-repeat, since he was not symptomatic, as far as the stone are concerned, operation still may not be needed. Just observe and monitor. Again, it all depends on the doctors advising him or her. So ito yung mga documentations. Okay. The first one, this is part of the whole ultrasound of the whole abdomen. Okay. So there is cholelithiasis, there's stone. Okay. The stone is about the average of 0.5 centimeter. So 5 millimeters, maliit lang ito, 5 millimeters. Kasi maliit lang masyado, sabi ko, baka mali, no? So I decided to have a repeat ultrasound. This is the repeat. Now, malabas ito, polyp lang. Okay? Polyp. Yung nakadikit lang sa pader, sa wall of the gallbladder. It will not cause any problem. Okay, so the first ultrasound, gallbladder stones, repeat ultrasound, gallbladder polyp. So this illustrates the dilemmas, okay, and the diagnostic errors of the tests that are done, okay, are commonly seen in practice. Okay, I think I've been talking a lot already. Okay, let's try to summarize. I have discussed what are the laboratory tests, general types, how to read and interpret those with numeric values, how to read and interpret lab tests with narrative description and conclusions, and what are the issues, especially indications and examples of dilemmas and errors in lab results. Okay. So, although the reports are written for healthcare professionals, especially the narrative reports, and not for patients, there is a lot that you can learn by looking, studying, and learning from them, especially after this PEP talk. I hope you will benefit. You will benefit from this PEP talk. And then remember the indications for the laboratory test to screen, but there must be valid indications for the screening. To have more definitive diagnosis, again, there must be valid indications to go for a more definitive diagnosis. Okay. To determine the severity, again, there are mga subsets of indications, and then to monitor the progress. Okay. So also remember, wag yung shotgun approach. Okay, try to you can decipher naman yung mga doctor, no, who are doing shotgun approach or who are doing rifle approach. Ang pinakamaganda, rifle approach lang. Okay. And then another lesson, another value that we have to remember, especially for doctors, we usually advise the doctors this, no? Since time immemorial, those experts in medicine, the pioneers in medicine, they always tell us it's important to treat the patients and not the lab results. But a lot of times, the concept is fading today. Physicians commonly do not do clinical assessment of patients anymore. They just look and rely on lab results without doing physical examination of the patients. So the lab results should be correlated with the clinical findings, particularly history and physical examination. So lastly, takeaway in relation to patient empowerment. Be always in touch with reliable medical information on how physicians read and interpret lab results. Knowledge is power, it gives power. Use the four Ks of patient empowerment, kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in the medical management of oneself by having some idea on how physicians read and interpret diagnostic tests. Kahit na konting idea lang. Okay. So this ends my pep talk. I hope I have empowered you to have a better understanding of the importance and importance of readings and interpreting laboratory test results in your health management. So before we go to the question and answer session, reminder, the OLETE, take it, okay? And then 50 OLETE certificates equivalent to 1 voucher for telemedical consultation. And then please put your comments in the chat box, okay? If you're not going to take, even if you're going to take the OLETE, I encourage you to put some chat box because I also document them and recorded it. Okay. So let's now have a group picture taking. Okay, ready? 1, 2, 3. Let me save it first. Okay, the floor is now open for open forum, recommendations, comments, suggestions, consultations, short consultations, pwede rin. Okay. Okay, so the floor is open for questions of anything that you want to ask. Are we still on board? Apet? Wala tayo.
Kasi si Doc was not anymore, the internet was already cut off by.
Yeah, but I'm back. Okay na? Hello? Hello, Jackie?
Yes, hi. No, I was requesting if you could show the slide again and on
Which slide?
the slide on cholesterol.
On cholesterol?
Yes, because the internet participants.
Sandali. Nawawala. Okay. Are we still on?
Yeah.
Can you,
Yeah.
okay.
Yes, clear.
Sandali. I'll just, lola ko eh. I'll try to put on my mobile data na lang. Okay. So yung cholesterol, you want, nawawala. Share screen. This one?
No.
Ah,
Doc, it's around 255. Ayan,
Yeah,
yan na, yan na.
This one. Yes, this one.
okay. Yeah.
So you were saying,
What I'm saying is that there's some dilemma on how to interpret those results. No? If it's below 200, walang problema. But it's between 200 to 239. Okay, if you don't know how the doctors are reading that, no, so you're going to get alarmed. Let's say you have 205 to 10, no? Sabi mo it's above 200, so matatakot ka na. Tama?
yes,
Okay. But eto, butit na lang, may mga doctors nagsasabi, you just treat them as borderline high. Ganon, no? But again, it all depends on the doctor. Some would borderline high would just tell you get a diet, just rely on diet. Some will give you some statins already. Iba-iba. No?
diba?
So, but those who have at least 240, they usually recommend that they should be treated already. So as lay people, as you should also be aware of all these things, no? Kasi iba-iba yung mga doctors no?
So when you look at that, you don't look at the ratio, diba?
Yeah, there are some people who would look at the ratio kasi magulo nga itong mga mga lab results. Sometimes they back it up with computing the ratio of something, no? Okay. Ratio of the high density, low density, etc. No? So
Nawala ata kayo, Doc Ray.
nawala na naman.
Yes.
Meron na.
Now, meron na naman.
Meron na naman. Okay.
You were saying about the ratio. It's very confusing because some will look at the ratio and some will say no, even if your ratio is within normal limits. But if your readings are high, then what do we do? Which one do we look at?
Kaya sinasabi ko sa iyo, maraming issues, may dilemmas and errors on how to interpret, no? Okay.
Mhm.
So it usually starts with total cholesterol. There's a number, di ba? 200
Yes.
hanggang po. And then because naguguluhan yung mga doctor, is it really that significant na kailangan gamutin, ganon. So they try to look at other backup things. They put the ratio of something. Then kung pangit ang ratio, then they said, okay, we treat. If it's 210 and then the ratio is this one, then we treat already. Ganon. Okay, but everything is not 100% certain pa rin. Guide lang yon. No?
Mhm.
That's why I said medyo magulo yung mga lab exams. If you don't need it, don't do it anymore. Okay, even doctors will have different ways of interpreting. No, as I said, may ritualistic, may maximalist. No, okay. So maximalists tend to overdo things, di ba?
Yes. I take note of this because my cholesterol levels have always been on the high side. Like it's always 220 plus to about 230 plus, sometimes 240. And I have not refused in the sense that I've not taken any medications because my total, but my ratios kasi are always below the normal. I mean, it's within the normal limit. It should not be over 4, di ba? That's
Yeah.
what it is.
Uh-uh.
So now the cardiologist started giving me medications already because he says mataas na daw yung consistently mataas, mga 220 to 240. So while my ratio is still within normal limits. So I'm starting to question, should I really be taking that medication to start with if my ratio is within normal limits?
Oo, yeah. Kaya nga, sabi ko, sorry bottom line is magulo ko yung mga doktor. Okay, if you ask another doctor, probably he will give a different opinion. No? Okay.
Okay.
Parang yung sa yung sa mga blood sugar, di ba? May mga matataas, let's say 120, 130, tapos You take the HbHC1c, normal naman, sabihin, wag na, wala nang gamot. No? Iba-iba rin interpretation ng mga doktor. No? Okay. So sa akin, bottom line is healthy diet na lang. Healthy diet. Try to control your diet and exercise. No? And then, paano nga, how do I advise you? 240, pag extremely mataas na, then you take it na lang. Okay? Yung mataas na mataas. No? Huwag lang yung, let's say, slightly normal and then yung ratio is still within the acceptable limit. Pwedeng wala na. Just do the exercise and the diet control.
So I'll stop my medication, the one that I started 2 weeks ago.
Let me check, but I'm not a cardiologist.
Yes.
Let me check. You give me I'll study them. No? I'll try to
Okay.
analyze it for you.
Okay. Thank you.
Okay.
Thank you.
Okay. So for this lecture, I'm giving you the general principles lang muna. Okay. As I said, I told you last week, ang hirap kumuha nitong lecture nito. No? Mahirap talaga. No? Kasi it's walang hard and fast rules on how to interpret. No? Okay. But the bottom line is, do not do the test if not needed. No? Huwag yung mga screening na just for the heck of it, no? Paggawa ng paggawa. Kasi kung nagpagawa ka ng 20, 10 or 10 tests, chances are you're going to have mga out of range values. No? Okay. Even the report, makikita yung mga wala kayong nararamdaman sa abdomen, lalabas yan, gallbladder stones, gano'n. No? Okay. Okay. Anything else?
Yes, I have.
Jackie,
Doctor.
wait. Jackie, padala mo na lang sa akin. Yeah.
Yes, doctor. Okay, thank you.
Jocelyn. Is it Jocelyn who was talking?
Yes, it's in the chat box.
Okay. Chat box.
Shall I read it, sir, for you?
Okay, can you read it para hindi ko mahanap?
Okay. Share ko lang, Hospital A. Ultrasound reader said I have a small mass in the right breast, no mention of cancer. Hospital B reader said that small mass is cancerous. Attending surgeon said I just have to observe since walang nakakapa.
Okay, how do you want me to comment on that?
What's your comment?
What's my comment? As I said, in the end, it will depend on you have one surgeon dito, di ba? The other two are just reports, di ba? Reports lang dalawa by the radiologist, no? So yeah, the attending surgeon will have to make a decision, no?
Yes.
Okay. So kakapain niya yung breast mo. Kung wala siyang nakakapa, he might parang yung second example ko kanina, yung sa breast, no? BI-RADS 4, BI-RADS 3, gano'n. Diba?
Yes.
So, my policy is that if I'm not able to palpate anything, I'll just observe.
Okay.
Then, when you say observe, you can kasi you have two ultrasounds already here, di ba? Ultrasound says,
one in Hospital A, another in Hospital B.
Kaya nga, interval.
A week or two.
A week or two. Okay.
Yes.
So which one will say cancerous? The B? The latest?
Manila Manila doctors.
No, don't mention name. But the second one comes after the first. Yung breast, yung cancer?
Yes.
Okay. So, just have to observe. Sabi, anong explanation ng attending surgeon mo? I'm not the one, di ba?
You're not the one kasi hindi pa kayo nag-face to face that time.
Okay. So, since walang nakakapa, tama. Since walang nakakapa, that's also
Observe. Observe. I like to have an ultrasound done sa another hospital, C. Pero sabi ng doktor, wag na.
kung minsan pwede rin, if you are still anxious about it.
Yeah.
Pero what was the time interval na from the, when was the hospital? Hospital B, kailan yon?
Last May na eh, matagal na.
May, June, July, August. Okay. Okay, so kaya nga it all depends on your surgeon's explanation, no? And then recommendations. Now, kung talagang siguro siya confident siya wala, you can have the ultrasound, let's say 6 months after. The question is where to have it done. You don't do it in the hospital.
Hospital. Yes, I plan to go to another hospital.
Yeah. If you really want to have another opinion, don't have it done in hospital B because chances are they will stick to that.
Okay.
Okay.
Thank you, Doc.
Okay. I do face-to-face now for your sake. I'll do it.
Yeah, thank you.
Okay. Any more? Abet?
Chat box, wala na. But there is someone who would like to ask you something, Mr. Kevin Lin. This was referred by Bebot.
Hello po, no.
Oh, Kevin. Okay. Ano?
Hindi po, halos same sentiment po kay Ma'am Jocelyn yun. So sa ngayon kasi 1-1 na yung sabi unang doc surgery, sabi na onco hindi na daw po kailangan. So inisip ko kung maghanap pa kami ng third para break the tie.
Pwede rin. Pero what's more important is to assess yung mahirap yung i-assess yung competency. The one that okay. Tawag doon.
Or hindi naman po kung sakali lang may non-invasive na na option maliban sa surgery.
Okay, sige. I'll go straight to the point now kasi mahirap isagot na theoretical lang. What's your problem ba? What's the ano yung concern? Anong concern?
Sa breast cancer din siya.
Breast cancer din. So, na-opera na? Di pa?
Hindi pa po. Yung unang doc suggest tanggalin na pero sabi niya mag second opinion. So nagpunta ko kami sa oncologist. Oncologist.
Oh, sinong oncologist? Maraming klaseng oncologist. Medical onco, surgical onco. Ano?
Hindi ko po. I-confirm po na lang po ulit. Hindi ko naalala.
Okay, so since you're confused pa rin, so you can seek another opinion, but when you seek another opinion, you must know how to recognize doctors who are good in doing, kahit na yung proseso lang, who explain things to you. Okay. So, paano ka napasok dito? Who invited you dito, Kevin?
Yung anak ko ni Auntie Deli, kaibigan ko po.
Sige. So you want to consult me? Okay lang. I will congress. Okay. So I'll give you an appointment, mamaya. Okay.
Thank you po.
It's hard to explain it here kasi we might be running out of time. No? Okay.
Opo, thank you po.
Okay. Any more?
There's nothing more at the top of the
Nothing.
chat.
So any more comments from who are the newcomers here? Olivia.
We have Olivia Mendoza.
Olivia, any comment, Olivia?
Wala naman po, Doc. I'm just listening. Thank you.
Okay. So how do you like the lecture?
Very informative po. Para sa mga kagaya namin na layman, hindi marunong talaga. Parang nakaasa sa mga doctors, sa sasabihin ng mga doctors. Salamat po.
Okay. Sige. So you're welcome to attend my future sessions. My next session will be, I will zero in on yung mga specific, as I said. No? Probably I'll talk about ultrasound and mammography, how to read and interpret. No? No? Then after that, probably thyroid. No? How to read yung mga thyroid function test. Parang magsisiro in ako by some diseases na. No? Okay. Ngayon, it's all generalities, mga principles lang ngayon. No? Okay. So, no more? there are no more questions. No, we'll call it a day. No. Kevin, you just keep in touch. You have my cell phone number.
Oh, wala pa po. Hingin ko na lang po.
Okay. Sa Facebook. Okay.
Opo.
Sige, don't leave first. For the others, if you want to leave, you can leave already. No? Okay, so we'll call
Okay, bye. Thank you, Doc.
Thank you, Doc.
Thank you, Doc.
Thank you.
Thank you, Dr. Day.
Thank you. Thank you, Doc.
Bye.
Bye. Bye.
Thank you, Doc.
I will just type my name and then my number. Kevin?
Opo.
0918 804. Okay. So just text me na lang. Okay.
Pwede po pa ulit. 0918
040304.
304. Okay po. Thank you po.
Okay. Okay. So
Opo.
my Facebook, ROJoson. Ito, tinype ko na. Ha?
Opo.
Okay. Sige.
Thank you po.
Okay, so sige, right after, text mo na ako ngayon before I go for my exercise. No? Okay.
Thank you po.
Okay, sige. Bye-bye.
Bye po.
Bye.